All right, well, we'll get started. I'm Bruce Maxwell. I'm Director of the Institute on Ecosystems here at MSU. And this is our Rough Cut seminar series. And today we have with us Robert and Lori Byron, two physicians from Hardin, Montana. Lori is a pediatrician. Robert's an internist. And they're going to talk to us about human health and climate-related aspects. They're climate change activists of sorts that are interested in the connections between climate change and human health. And so we're looking forward to what they have to say. Thank you.
Thank you. And
tag team.
Yeah, we will tag team. And thank you for the invitation to be here. We appreciate it very much. As Bruce said, Lori's a pediatrician. I'm an internist, live in Hardin. In looking over the history of rough cuts, looks like we're kind of outliers here. We don't do primary research in anything. The information we'll present is other people's research and based on our experience. We both been practicing for over 30 years. Most of that was on the Crow Indian Reservation. And now partly at St. Vincent's and partly at a community health center in Hardin. So we've been dealing both with patients individually in the room on a daily basis, but also very much from a public health aspect, which deals with populations. And so that's how we ended up here. Our topic today is climate change, health solutions. What we'd like to do is present some information on the health impacts of climate change, which is a little bit of a horror story, if you will. But we'd also, more importantly, like to present some things that we all can do and some potential solutions along those lines. To steal a cartoon from the health literature, what fits your busy schedule better? Exercising 1 hour a day or being dead 24 hours a day? Very appropriate to climate change and kind of where we are with it. Sort of our goals today are just to give some familiarity with some of the health impacts, discuss actions that we can do to help mitigate climate change with a health slant to that, and then also some specific actions that any of us can take. One thing that I think is important, and that is, it's not all doom and gloom. We can do a lot. There's lots of potential if we start to act together on this. Now, for those that are viewing remotely, I'm about to show a video that I understand will be blanked out. It will be available later online. So only the people in the room will be able to see it right now. And just a reminder that when we're talking about climate change, it's not about numbers, and it's not about 3 degrees or CO2 levels. It's about people, and that's what this is to represent. So keep that in mind as we go through today. And also, climate change will disproportionately affect certain populations first. Ultimately, it's going to affect everybody. But right now, the poor, the indigenous, women, children, particularly pregnant women, and primary job employers are people who work with minerals in the land. So, in the interest of education, we have to have a question, 3 questions. So, which of these conditions are associated with fossil fuel air pollution? And I'll explain that wording in a minute. Asthma, heart disease, stroke, premature birth, autism, dementia, and lung cancer. And the answer is all of them. Every single evidence is very solid on all of these. Just so you don't think it's just a couple of people or individuals, I'd like to point out that there's a lot of organizations behind this. Unfortunately, until the past couple of years, the healthcare professionals have been relatively quiet in this area. That's changing rapidly. Last year in 2017, the Declaration on Climate Change and Health, the health impacts of climate change demand immediate action. Communities across the nation are experiencing health impacts of climate change. And this was signed on to by, you can see the organizations, or several of them listed at the bottom: American College of Physicians, American Academy of Pediatrics, American Lung Association, American Public Health Association, a huge number of healthcare organizations in the United States. In 2015, the Lancet Commission on Health said tackling climate change could be the greatest global health, and this word is interchangeable, opportunity or disaster. It's our choice. But this is a huge opportunity, and we hope to convince you of that. The Lancet Commission also said that the single most powerful strategic instrument to inoculate human health against the risks of climate change would be for governments to introduce a strong and sustained carbon pricing. This is coming from a healthcare commission. This has also got lots of support from economists worldwide. It's a fairly busy slide, but just as a reminder and things we'll talk about in a little more detail, adaptation strategies or solutions. The first one's the comment on from the Lancet. Switching from fossil fuel generated electricity to clean energy sources will reduce air pollution, lower rates of disease. Using active transportation like walking or cycling to make short trips can improve cardiovascular health as well as impact climate change. Planting trees and installing green roofs reduces urban heat island effects. Not a big problem in Montana, but certainly in large parts of the world, a huge problem. Eating less meat and more locally grown fruits and vegetables can reduce carbon pollution and also promote better health. All things that we can think about and will allude to later. Again, a kind of a busy slide here, but just so we're all on the same page, we're not going to talk about the science of climate change, but we are going to talk about the impacts. But what we expect, rising temperatures, more extreme weather, rising sea level, increasing CO2, they're all interrelated. The next level out is what will that cause? Air pollution, which I'll talk about again in a minute, increasing allergens, water and food supply impacts, extreme heat, and then the specific effects, increased asthma and cardiovascular disease, respiratory diseases, infectious diseases, malnutrition, forced migration, and civil conflict. Now, the reason I mentioned about air pollution is the cause of climate change, or anthropogenic climate change, is air pollution, plain and simple. Mostly CO2, but with certainly other big players in there, methane, as well as others. But climate change also increases air pollution. As heat goes up at any given level of air pollution, ground level ozone increases in the atmosphere, which leads to more impacts. Now, let's put it in perspective a little bit. Climate change is not the cause of all evil, but there's certain independent effects of climate change, is the way I like to think about it. Sea level change, extreme weather, more droughts, but it's also an amplifier or catalyst of things that are other processes. Yes, population growth is a huge factor in this, both a cause and other factors. Global travel, absolutely that's an issue. And conflict and war at many levels. Climate change can worsen this, but also this can impact climate change from the effects that are happening in many areas where there's conflict. Now, I'm not going to spend a lot of time on Montana climate assessment because there's people in here that help write it, but just a couple things for perspective. In Montana, average annual temperatures have risen across the state a couple degrees with anticipated increases over time, but there's been no historical change in annual precipitation so far. And that's an important factor because we're looking at annual precipitation. With climate change, the expectation is that may not change in some areas. Now, Montana's relatively mildly affected in a lot of the climate models compared to other areas. But that precipitation will come in more intense rainstorms and snow with longer periods between without. And here's some of the other things from the Montana climate assessment from last year. Precipitation projected to increase in winter, spring, and fall, and decrease in summer. Snowpack has declined. A little hard to imagine that this year, but what we expect to see is a shift towards earlier snowmelt and earlier peak and spring runoff, and then longer periods between rain. That will put an increased demand on groundwater and we'll need to look for other sources of surface because of decreased surface water. Okay, so let's switch to health. What are some of the anticipated impacts of climate change? But actually, these numbers are impacts now of air pollution. Increased particulate matter is associated with increased heart attacks, cardiac dysfunction, and blood clots. Already in the United States, estimates are upwards of 20,000 heart attacks per year due to air pollution. Now, there are a lot more heart attacks than that, and there's a lot of other things that impact that. So it's not just air pollution. These are increased numbers of heart attacks based on several models. Worldwide, WHO is estimating over 3 million cardiac deaths per year due to air pollution. Stress from the weather events is associated with increased numbers of heart attacks, sudden death, and cardiomyopathy, which is a weakening of the heart in general. And even infectious diseases. Chagas disease, which affects about 20 million people worldwide now, is a tropical disease. It's an independent risk factor for both stroke and heart failure. As I'll show you in a minute, is as infectious disease spread, particularly tropical diseases, we would expect to see more of this. So, talking about air pollution, what you're seeing on the left, actually on the left and right, are crosscuts of arteries. I can't tell you these are coronary arteries or heart arteries, but basically we see a fairly wide open artery on the left, a not so wide open artery on the right, that with very minimal increase will close off, cause a heart attack or a stroke, depending on where that artery is. Good data shows, this is from the California teacher study, shows that people living closer to freeways have both markedly increased risk of this, and it starts younger. And that's from air pollution living close to freeways now. This is not some future thing. Diabetes. I put this in with cardiovascular because diabetes is an independent risk factor for cardiovascular disease and stroke. Increasing temperatures leads to an increased insulin resistance and diabetes. Estimated from British Medical Journal, 100,000 more cases in the US with a 1 degree centigrade increase in temperature. And why does this happen? We're not totally sure, but it may be related. One of the factors in this could be the fact that I used to think that particulate matter, particularly small PM 2.5 and below, was kind of an inert substance. And it's dust we get in our lungs, no big deal. That's not correct. Particulate matter is a very biologically active combination of things. It results in increased inflammation in the body, which may be one of the factors leading to these increased deaths. Respiratory diseases. 30 million Americans, so about 1 in 12, suffer from asthma. Worldwide, about 240 million. WHO estimates about 200,000 deaths per year. This is from just asthma. Worldwide, WHO estimates about 8 million deaths per year from air pollution. And it's worth pointing out that about half of that is outside air pollution, which mostly what we have in the US in large cities, but the other half is inside air pollution. Again, a little bit from what we see from burning fires, mostly from burning charcoal in closed spaces, which is in a large part of the world is how they both heat and cook. So it's a major problem. This is current. This is not going in the future. Data, and I'm not sure if this is published yet or not, from the Rice Ridge Seeley Lake fires of last year. In Missoula and Powell County, 378 emergency department visits for respiratory symptoms last year compared with 163 the year before over the same time period. That's 2.3 times higher. In the elderly, 111 visits compared to 39 the year before. In 5 to 17-year-olds, 21 visits compared to 14. Now, that's probably not statistically significant just because of the small numbers that we have, but it's certainly awfully concerning to see those kind of numbers. That's from forest fires. Looking elsewhere from maybe some larger data, this was looking in Southern California. This is not from forest fires. This was from mostly ozone. As I mentioned, as temperatures increase with the same level of air pollution, ozone levels increase. Estimates from these studies show that it gets smoggier, and smog is ground level ozone. For about every 10 part per billion ozone increase, 7% increase visits to the ER from pediatric population, 4% increase in elder admits, and about 0.5% increase in deaths from this alone. Closer to home, as it gets smokier, and this was from data from Southern California, the fires of 2013, so the numbers here are much better. Elder admits went up 70% during that period to the hospitals, and pediatric asthma admits went up 34%. As I said, this is now. This is air pollution as it exists in the United States now, not some future thing. By some studies, and these are estimates, these are not firm numbers, but the estimates from a couple studies are that currently in the United States, there's 200,000 premature deaths per year due to air pollution, 180,000 non-fatal heart attacks, 150,000 hospitalizations, 130,000 ER visits, 18 million lost work days now based on air pollution. And the smokestack in the background is key because it's mostly from fossil fuel generation. Not entirely, but mostly. So does it make a difference? Can we do anything about it? Absolutely. In 2011, I-405 in Los Angeles was going to be shut down for about 36 hours for repairs. The Los Angeles called it Carmageddon because the traffic mess and they weren't going to be able to drive their cars. What happened was within minutes, air quality within 100 kilometers improved. Ultrafine particulates dropped by 83%. PM 2.5 is down 36%. And ER visits at UCLA, which is right in this area, dropped by 23%, Mount Sinai by 13%, and 9/11 calls went down by 12% during that period of time. So that wasn't some future, that was within hours. Was that a fluke? No. 1996 Summer Olympics in Atlanta, same thing. Traffic restrictions dropped traffic about 23%. Ozone levels dropped 28%. Emergency room visits for children with asthma dropped 42% during that period of time. So it does make a difference, and it can make a difference quickly. Let's switch to tropical diseases. We're starting to see some spread of tropical diseases more worldwide. And again, this is, as I mentioned earlier, this is where climate change is a catalyst, not the sole cause. Certainly global travel is a big issue with this. Certainly increased population is a big issue with this. But one of the bigger issues possibly is because as it warms, the vectors can spread. This doesn't show malaria on here, but malaria has started to spread to increased elevations. A lot of people in the higher elevations were protected. Now we're seeing increases in malaria because the mosquitoes can move higher up in the mountains. Other things that happen, malaria is a good example because malaria affects about several million people a year and results in, I believe it's about 400,000 deaths per year. Because as things warm up, the malaria parasite matures faster, mosquitoes bite more, and as I said, they're more widespread. In the United States, this is an example, this is projections from 2017, so last year from CDC, showing on the left the range of Aedes aegypti mosquito, and on the right, the Aedes albopictus, which is a tiger mosquito. Both of these are vectors for, particularly the Aedes aegypti, is a known vector for dengue, yellow fever, among others, Zika. The tiger mosquito also can carry it, but these ranges are expanding. Now, we don't have outbreaks, large outbreaks of either of these in the United States of these diseases because we don't have a large base of people who have it, but the potential is there. Foodborne and waterborne diseases. Worldwide, diarrhea is the #1 or #2 cause of death in children under 5 years of age, with about 1.6 million deaths per year. Data from the United States showed that every degree increase in temperature, every degree centigrade increase in temperature results in about a 2 to 6% increase in foodborne illness. 2/3 of the gastrointestinal outbreaks in the United States followed heavy rainfall, and That's from 1948 through 1994. So that's kind of independent of climate change time periods. What happens? Well, depending on where you are. In cities, flooding can result in overwhelming the sewer systems. In New York and Pittsburgh, it's estimated that less than 1/2 inch of rain will overwhelm their sewer systems, so you're dumping raw sewage straight into the rivers. And then also, diarrheal illness is more common with both low precipitation, so droughts, probably because of stagnation, and high precipitation. Think back to some of the pictures we've seen of Hurricane Harvey and others, and just imagine what's going on in those waters. Those are in locations that have good sewer systems. Think about a lot of the world where they do not have good sewer systems. And an interesting one, rising ocean temperatures. Something like 90% of the heat increase that we've seen in the atmosphere has been absorbed by the oceans. So we're starting to see increase in temperatures. Cholera, which is caused by Vibrio cholerae, is a warm water organism. But now we're starting to see it in Alaskan animals. And one more, the Naegleria fowleri, which is the brain-eating amoeba. And this is not to say we're having an epidemic of this. Don't misunderstand. There are very few of these in the United States on a yearly basis. But it's been reported now in Minnesota. It should not be in Minnesota. The water should be cool enough there to prevent this warm water organism from being there. But that's the kind of things that we expect to see. And unfortunately, those aren't the worst things. I'm going to turn it over to Lori.
So I've spent my life in maternal child health, and so I'm particularly partial to things that affect women, infants, and children. And all of these events, these things that Rob has talked about and the things that I will talk about affect them because they are vulnerable populations. So they're going to be affected more. The most poignant moment of my training in pediatrics occurred when the first baby died on my shift. And it was a baby that died of SIDS. And I can still see the mom sitting in the emergency room, rocking her baby, her dead baby, and singing, "Eric Baker, I love you." And I cried then, and I cry now when a child dies that's under my care. And it's because of this passion that fuels my passion, because of that concern that fuels my passion for conditions that harm children. We had no clue back then what caused what we called crib deaths or SIDS deaths. It wasn't until after I finished training that we even found out that cigarette smoking in the mom caused crib death. And it hasn't been until the last couple of years that we saw that actually any particulate matter in the air that the pregnant mom breathes affects the baby. So in 2016, New York University School of Medicine said that 16,000 premature births a year, 3% of our premature births in America, are due to air pollution. So they've linked both premature birth and intrauterine growth retardation on what the mother breathes. And it doesn't matter what particulate matter she breathes. So whether she's smoking or exposed to forest fires or near fossil fuel or traffic-related particulate matter or even dust, all of those things are bad for the baby. There's been 9 different studies on what we now call SUIDs, sudden unexpected infant deaths, which used to be crib deaths or SIDS deaths. And 9 different studies have shown a link, but not a definite causality. In addition, air pollution that the mother breathes can affect the baby in other ways. And so we've actually found about double the amount of childhood obesity when mothers are exposed and breathing in polycyclic aromatic hydrocarbons. And that happens anytime you burn fossil fuels because they're always incompletely burned. So another issue that's really near and dear to my heart as a pediatrician is nutrition and malnutrition. And as Rob said, a lot of deaths are due to malnutrition already. We have 1 out of 8 people in the world that can't live a healthy lifestyle because they don't have enough food. And even in America, 14% of Americans are food insecure. And a lot of those are children. And it's not just an acute, temporary, not knowing where their next meal is coming from. It really has far-reaching implications that affects their entire life when they've gone hungry as a child. So as a pediatrician, I'm concerned about whether food is present and whether there's adequate quantities and adequate nutrition in the food and whether it's affordable. So on that question, I will move forward with a little bit of trepidation because we're going to talk a little bit about agriculture and nutrition. And I haven't done that in front of a group of scientists before. So please correct me later if anything I say doesn't sound quite right. But we lose about a third of our crops because of crops, about a third of the crops that are lost are due to crop pests and pathogens. And we've had this migration of pests and pathogens, just like the mosquitoes that are moving into areas that used to not be warm enough. So they've had this poleward migration where in our hemisphere, they're moving north, in the southern hemisphere, they're moving south, and we have a larger swath of the world that's affected by various crop pests and pathogens. And they've actually looked at hundreds of pests and found that this has held true. In addition, we all learned back in very basic biology that plants like CO2. And so a lot of people have predicted then that plants and agricultural plants would be better off with increased CO2. And I know you guys are doing research on that right here at MSU Bozeman. This particular study was out of Illinois, but they looked at CO2 and soybeans. And they found that the pathogens, the aphids and the Japanese beetles, were more drawn to the plants that were raised in increased CO2 environments. Not only that, but kind of like the mosquitoes, the aphids and beetles laid more eggs and they lived longer, and the plants were less resistant to the diseases. In addition to that, we found problems with the actual quality of the agricultural plants. So they've looked at the big four in the world, which is corn, rice, wheat, and soybeans. And they found that there's increased CO2, that with increased CO2, they have decreased protein content by about 6 to 8%. And this is significant. It doesn't sound like a big number, but this can have a couple different effects. When you're in a society like ours where we have a lot of obesity, if you are consuming more carbohydrates compared to proteins, you actually are more at risk for metabolic syndrome, which is a precursor to diabetes and heart disease and stroke. If you're in an area where there's predominantly hunger, having less protein in your diet puts you more at risk for something called kwashiorkor, which is protein energy malnutrition, which is a much more serious form of malnutrition and affects the immune system. In addition, they've looked at the micronutrients and the minerals in plants, and they found that as they're raised in increased CO2, the zinc and iron levels and other micronutrients are decreased. I mentioned zinc and iron in particular because we already have a fourth of the world's population who are deficient in one or the other or both of these. And then there's also issues with productivity of the grains as it gets hotter. To most of us that aren't in ag, it just seems like warm weather should make plants happy, but only so warm and not too warm. So there was actually a study, a meta-analysis last year done by PNAS. They looked at 70 different studies across the world with these big four crops. And they found that with increased temperature, the crop yield for about 1 degree increased Celsius, the crop yield went down by about 3 to 7% across the world, larger in some areas. Of course, it's almost not even worth saying that we can see what drought's going to do to our crops. And it's also pretty obvious what saltwater intrusion does to our crops. And this is happening across the world, but in particular in the United States, in the Carolinas, in Maine, in Louisiana, and certainly destroys the land for agricultural use. There's a new disease that's come about in the last decade. They've named it Mesoamerican Nephritis. It started in South America and in Central America, where it's a little bit hotter than here, and almost always affects farm workers. And farm workers are basically out in the heat every day, and they're not drinking a lot, and they don't have a lot of access to bathrooms. And basically, it's a chronic dehydration state. 20,000 people have died so far from it. And it's now in California because America is getting warmer. So another issue that affects the food supply for the world is the oceans. And Rob has already mentioned that they've been gracious enough to absorb a lot of the heat from the atmosphere. But of course, that's affected our coral reefs. And we never had coral reef bleaching and dying off until the last couple decades. And besides just losing all that beauty from scuba diving, it's really important for our fish. About a fourth of the fish species start out their life living in the coral reefs where it's safe. So just like Rob said, with other issues, there are a lot of other things that are affecting our fisheries, but climate is a big one. And because the oceans have become more acidic by absorbing the CO2, that's harming the shelled animals, because during the time that you lay down your shell, if it's too acidic, you can't lay down your shell because the shells are calcium carbonate. And this affects the oyster populations. They've had a lot of problems out in the Northwest with the oyster farms. And it's also affecting the zooplankton, the pteropods, because they have shells also. Another issue is food prices. Even if there's food and you can't afford it, it doesn't help you very much. So Oxfam has predicted that in the 20-year span that we're in the middle of right now, that food prices will increase across the world by 180% because of climate change. People complain about food prices in America, but really it's not that much of an issue here. We spend 6% of our income on food. In Europe, they spend 10 to 20%, and in a lot of poorer, lower income countries, they spend 45% of their income on food. So this is a big deal. However, it's not gloom and doom, because this can be opportunity too. And there's a lot of things happening, in part because of the research that some of you guys are doing, and in part because we have these farmers markets that are happening in America. We now have 80,000 farmers markets. It gets people out, it gets them walking, they have a stronger sense of community, and they're eating healthier foods. As of last year, we finally crossed the 5% mark. Over 5% of the food raised in America is organic now. And that, again, helps people health, but it also helps the soil health, because it tends to be sustainable agriculture, and they're putting the carbon back in the soil where it should have stayed over the last 100 years. In addition, we have a little bit of margin here, because back in World War II, people raised 40% of the vegetables that they ate during the war in their own backyards. They were called victory gardens. And so if we have to, we can do that again. And the super cool picture in the middle of the slide is a New Holland tractor. It's hydrogen fuel cell. It was invented in 2011. So the technology is coming. Extreme weather events also affect our health and cause deaths in the world. And there's about tenfold as many extreme weather events as there used to be about 50 years ago. So across the world, we have about 60,000 deaths a year, but it's really variable year by year. They actually lost 70,000 people just in Europe during the heat waves about a decade ago. They lost 40,000 in Russia in 2010, and they also lost most of their wheat crop that year. We now have this new group of people called climate refugees, and they're people who can't sustain their way of living where they lived, and they have to move. For some, it's temporary, like after floods and hurricanes, but for some, it's permanent, because after sea level rise or saltwater intrusion or desertification, they can't grow food for their family. We actually have 20,000 climate refugees now living in America. They're from the Marshall Islands. And we apparently promised them a place to live if they ever needed it, because we practiced bombing them back during World War II. So now they've had severe drought and they've had sea level rise, and their islands are less habitable. And most of them are living in Arkansas, by the way. Don't ask me why. So the heat is affecting the poles more. And so the Arctic area is warmer even than what we are experiencing. And we are having problems with our Alaskan villages. We have a dozen that need to be relocated, another 30 that are at risk. It's incredibly expensive to build in the Arctic, and no one has stepped forward to be willing to pay the bill to move these places. And in addition, a lot of these communities are indigenous communities, and these are place-based people. And another relocation in their lives is even more traumatic than what it would be in ours. Rob and I got a really small taste of extreme weather events, and this was not an extreme weather event because it was way too small. But the wettest year on record in 2011 was 2011 in the spring for Montana, and we had flooding of the Bighorn River, and it lasted for a couple of weeks, and it went away. And so most of you might have seen something in the paper or a picture on the news, but that was basically it. But what we saw on the ground was something that struck Rob and I, and that is the people that were really affected were the people that were just barely getting by. So if you just now lost all your clothes, or all of your drywall got ruined, or your house became mold infested after this flood, you just couldn't get back on your feet. So we still see people now that are living in FEMA trailers, that are living in the basements of relatives' homes, or that are homeless. And your ability to live a healthy life and to raise healthy children in that kind of situation is very difficult. After Hurricane Sandy, 750,000 people were displaced. And I mentioned Hurricane Sandy and not more recent hurricanes because this is 6 years ago, and there's still thousands of people who are living in suboptimal housing, and tens of thousands who haven't gotten back to economically where they were before. So it really does have wide implications. And so speaking about the stress of moving, mental health is also a big issue. Just in the last year, the American Psychiatric Association joined the other medical societies to say that this is a big issue and we need to be acting on it. We've known for a long time that violent behavior and suicide, alcohol, and substance abuse happen more when it's hot. We've only found in the last decade or two, have they really done good research, most of it was after Hurricane Katrina, that PTSD and anxiety and depression are very common. And especially for children, these conditions can last for years or decades after severe weather events. We know that some of the psychotropic medicines interfere with heat regulation, so this is another group of vulnerable populations. And then really much newer data is the last few years with, again, when the moms are breathing particulate matter, their children have about double the risk of both schizophrenia and autism. But again, all's not gloom and doom, because I think we're finding more holistic solutions in the world that is going to both improve health of the people and health of the planet. So one that Rob briefly mentioned was urban trees. And they've actually found that urban trees are very, very healthy for us. And in fact, they reduce stress levels and they cause people to get out in the city and walk more. And in fact, they've done some research in cities, so you have similar socioeconomic status neighborhoods in inner cities with the same temperature and climate. And they look at the places that have trees versus the groups that don't. And they actually find that the people that have trees are 40% less likely to be obese, which is just an incredible statistic. And so not only that, so these trees are helping our mental health, they're helping our physical health, and of course they're helping the health of the planet because they are absorbing air pollution and they are helping with runoff from the severe weather events in cities. So the bottom line is that we really need to embrace a low carbon economy. And I think that a lot of us have learned in the last few years that just doing good science or just practicing good medicine really isn't enough nowadays. We have to communicate that good science to other people. So there's a whole new nonprofit that you all probably know about called 314 Action. They're training and supporting scientists to become politicians. What a novel idea. So I think we're to the point that our personal actions like buying sustainably and changing our light bulbs is really not enough. And many of the experts in the world have suggested that putting a price on carbon is the fastest way to make this transition. Rob mentioned this briefly. It's happening all over the world. The colored portions already have carbon pricing, and then the diagonal lines are places that are implementing carbon pricing. And if you'll note on the map, the two places that are in the top 10 biggest emitters in the world that are not carbon pricing is the United States and Russia. The great thing about carbon pricing is that it grows the economy and jobs and saves lives. So there's actually some portions of America that have been doing this, and a lot of people are unaware of this, but for 10 years, we've had these northeastern states, and they have had a cap and trade system. And California has had a emissions trading program along with Canada for the last 10 years. And in both of these places, they've grown their economy, they've grown their jobs, and they've decreased deaths because of decreased air pollution. So there's been a lot of study on economics in medicine over the past few years on how this transition, how affordable these transitions are. And this is kind of a funny way to look at it, but it really gets the point across. This study was done showing that the cost to cleaner energy is going to cost less than $30 a ton to not put a ton of CO2 into the atmosphere. But for that, it's going to save over $200 in health benefits. And that's in America, so it's about 6 to 7 times the savings. In Eastern Asia, it's actually 10 to 70 times greater savings. So I think that we all can do something, and it depends on our talents and our personality and our profession. But most of us have friends, and if you have friends, you should talk about climate, because most of us don't. It's been researched over and over again in America that we just don't talk about climate. Some people have more time than money, and some people have more money than time, believe it or not. And if that's your condition, you can divest and you can donate to these great organizations that are working to take climate action. If you use electricity, you can pay for renewals if you're under Northwest Energy, or you can put it in a solar bank. If you're shy, you can write letters to the editor and to our politicians, and you can call them after hours so you don't have to talk to a person on the phone and leave a message that you're concerned about climate change. And if you're an outgoing person, you can campaign for someone that has your values, and you can speak out. If you're active in a faith group, you can teach a Sunday school class, because there is curriculum in all the major religious groups on environmental issues and climate change. If you're a builder, you can do it sustainably. This quote at the bottom is Rob's. He says, it's the greatest group participation project ever, is climate change. So if doing something on your own is a little too intimidating, you can join a group. And even in Montana, we have lots of them. So if ag is your passion, join up with Arrow. If you're a ski bum, join up with Protect Our Winters. And also go to see Saving Snow next week at the Emerson on Tuesday?
Tuesday.
Yeah. Northern Plains is a grassroots group, and many of the projects that they work on end up decreasing emissions. MEIC looks at both science and politics and facts, and working to protect the environment in Montana. Citizens Climate Lobby works to put a price on carbon, and our own Montana Institute on Ecosystems that we're so blessed to have. Those of you in the room that aren't working for them, see what you can do with them. And I'd just like to spend 1 minute left and just tell you that advocacy really works. Who in here has heard of the Climate Solutions Caucus? Good. Okay, so it started out about 2.5 years ago. After the last national elections, there were 7 Republicans and 7 Democrats. There's now 35 of each. It's bigger than the Freedom Caucus, and they're starting to vote in bloc, which is really exciting. And I've heard from a number of knowledgeable, politically inclined people, which I am not, that this is actually a really big political thing. So advocacy really works. Between the Climate Solutions Caucus, we have the doctors that have come together in the last year under a big consortium. All the different societies all had their own statements that this thing mattered, that they all came together. So the Medical Society now represents over 50% of the doctors in America. And the nurses just came together 3 months ago to umbrella under one organization. And we have We Are Still In. And so after it looked like we might be leaving the Paris Climate Accords, we have all these groups that say they're still in. And so we are working in Billings with several nonprofits, strategizing how best to approach the city council and the mayor so that we can be still in. And so if you're not already doing so, think about that in Bozeman. So if all this is a little too overwhelming and you don't think you know enough, the first thing to do is get online and sign up for the free online course that teaches you about the Montana Climate Assessment. And from there, you can go on to other sites. Even though the EPA and a lot of other government sites have been kind of wiped clean of climate statistics, there's plenty of sites online, and that's a great place to start. So we really thank you for your time today, and we hope that everybody continues to be active on this realm. Thank you.
Questions for Rob Lord? Tell us again about the online course.
You want to talk about it?
There's an online course. And if you go to the IOE website, you can connect to that under climate change, the Montana Climate Assessment. Pull down menu. Have a look. I don't know what else to say about it other than it sort of walks through the different aspects that covered in climate assessment.
And there's no charge for it.
Yeah.
That was free. You said that.
Yes.
What kind of research do you think is needed in the medical field by researchers in Montana and beyond to kind of tell the story a little more? And then on the other side of that is, do you think that the medical people should be sharing more of this information institutionally and in clinics in a more formal way?
Yes, we do. To that last question, absolutely. And the medical profession, as I said, has been very far behind on this. And as somebody who sees patients in the exam room, it is hard. I admit that. But all the major professional organizations have come out and said, yes, you need to do this. I mean, we did it with smoking. It took a while, But this is bigger than smoking, and impacts our health at least more than smoking. And unfortunately, it impacts health of not just the people around you. It impacts the health of everybody. So yes, we do. In terms of research, hopefully we're going to see more data like that we saw when I put from the Sealy fire in last year from DPHSS. Part of the problem there has been sharing information, say, between hospitals and hospital systems, which, as you might know, a lot of that's prohibited unless it's protected from information. And in a small state like Montana, anytime you share that information below the state level, you can almost tell who it involves. So, but yeah, we need much more on that, and hopefully we're going to start to see some of that. Because again, the same shift that the professional organizations have said, you need to talk to your patients about this. It's important, just like their cholesterol and their blood pressure. I think there's also going to be a push for more of this kind of data to see what's really happening.
There's not many medical researchers in Montana. Paul Smith in Missoula is a pediatric pulmonologist that kind of actively does research. The problem with Montana is we just don't have enough people. Well, that's not a problem. It's an asset for us. But as far as doing research, we just don't have enough people to have statistically significant numbers. But they're doing a lot of that research elsewhere. I think one thing we found with research is, for example, in fracking, there have been hundreds of studies done, and none of them relate to each other. They're all looking at different distances away or different populations or different amounts of time. And so I think getting some of the research that's really consistent so that we have bigger numbers would be helpful.
Many of your things, you said there are so many deaths, so much change. I'm presuming those were per year.
Yeah, and those are per year, and those are estimates at this point. It's pretty widespread what some of those estimates are, but those are the best we have right now. Yes.
I had a question about that 314 action, the training, because I think that's one of the big gap that I see is that scientists are doing great work, and there's this gap between them and public health or the public.
Right. I think 314action.org, I think is the name of it. I think they've actually trained like 1,400 scientists since the last national election. And we've had some people get elected during that time. Some of that's just for city councils and stuff, but that's okay. That's a start. And we need more of it. We need some fact-based people out there.
So over the last, since August of 2017 and all the fires and clearly a lot of pollution in Montana from those fires, I thought it was interesting that I can't recall hardly a time when our congressional delegation or even our governor, in speaking about that pollution, mentioned health impacts. Is that consistent with what you heard? And if that's the case, is that because the medical community hasn't made this an issue, or do you think it's just because it's thought to be a political liability of some sort?
I mean, all of the above.
Okay.
It's literally because it's, as I said, and as Lori mentioned, certainly physicians tend not to be very politically active, unfortunately, in lots of cases. And it's only within the past couple of years that we're starting to see these major organizations. Once you mentioned the Medical Society Consortium, again, that represents well over half. I think it's up to 600,000 physicians in the United States now, speaking out that climate change is a big, big issue. And that's starting to take hold. But at the local level, tomorrow some physicians are meeting with Governor Bullock to talk about these very things of public health impacts of climate change, and to bring this up and make it more public. Unfortunately, climate change got politicized. It's not a political issue. I mean, it shouldn't be a political issue. It has become that. I mean, it should be a scientific issue. And that's what's happened. So hopefully those are going to start to change. We certainly, over the past 2 years, despite the current national administration and all they're doing against the environment, against climate change, it really has started to take off at many levels. Like Lori mentioned, we are still in. The number of cities, counties, and states that are involved in that has been huge, but we still need to do more. And part of what doing more is, in addition to what we do in our own lives, is start to not be quiet and speak up. And he said, it really does make a difference to the politicians, local, state, and national, to hear from us. When they don't hear from us, then they're on their own. We need to let them know what we think and that this is important. So, great question. Thanks for asking.
You know, in that regard, it was emphasized what the asthma and so on effects of Sealy and Missoula were, and it might be time for somebody to say something about that. Is there any kind of data that we would have, or do you see easy ways to get data that would inform such?
That I presented was the first data I have seen in that regard. And I've actually been asking the past couple of years, again, I work at St. Vincent's and Billings Clinic, and the hospitals over here. Part of the problem has been the privacy issue, right? And that's, that's a two-edged sword. We don't want to invade people's privacy. That's not the idea at all. But sharing that information, but that's the first time I've seen anything from Montana. So that's great to start to see that. Yes.
So prevention of these health effects at the individual level is still important. And I'll tell a scenario, and then maybe you two could talk about how you talk to your patients in practice about things. But last summer when we had smoke here from the Sealy fires, I know a woman over 70 who trains for triathlons, and I said, oh, be careful. The smoke is careful if you're going to run outside. The smoke is very heavy, and she kind of blew up at me and said, oh, I have a relative who's a firefighter, and if he's out there, I'm going to be out there running outside. And I didn't know what to say except to say, well, it's linked to all kinds of bad health things. It was a locker room conversation. So, but breaking through that resistance to attribute health effects, pollution would be difficult. I don't know. Do you have those conversations yourselves?
We try to, as I said, is in defense of nurses, physicians, and other providers, it's difficult because if somebody comes in for a sore throat, we also have to talk to them about their smoking, their hypertension, their cholesterol, and oh, by the way, you haven't had your screening colonoscopy for colon cancer. But at the same time, those conversations, carrying them on over time, that's what needs to happen. And that's where over the past couple of years, I'm hoping that more physicians are starting to have those conversations with people because it is important. Lori and I started getting really active a few years ago, and it was, we were naive, we had no questions about it, but it's been very telling to us of even amongst the healthcare professionals how naive they are to these impacts. It's not just the general public, it is everybody. And that's one step, is we need to get beyond that. We're starting to see more information with that. So hopefully we'll get there. Now, one other thing relative to what you were talking about, the fires and things, there are actually apps now. There's one called Air Now that can give you your local health air quality. And is it a good day to go out and exercise outside, especially if you have asthma or COPD or heart disease, or even if you're just completely healthy, and you can find that out. And that can start to help too, as people become more aware of that. And it's a good tool.
Yeah, I'm very impressed with the amount of effort you put into covering a wide range of health impacts. One that you didn't mention that I remember people speculating about is violent crime. assault and murder and the relationships with the temperature and climate. There's higher rates in warmer places, those kinds of things. Have you come across anything that looks like they've done a good job teasing out the impacts?
Yeah, I mean, I can't name the particular studies, but there's been numerous good studies done on that. And yeah, it's, definitely increased in high conditions.
So both domestic abuse and violent crime go up. One other interesting thing along those lines on the good side of things, I mean, Lori mentioned about the trees and the impact of that. And I just looked at a study the other day which showed in city settings where you take a vacant lot and develop it, not with buildings, but with trees or park, violent crime in the area goes down. And that's all it took. I say that a little bit lightly because that's a major thing, but that makes a difference.
Yeah. Just a little side note on the, on that's slightly related to that is there's some data back in the 70s on air pollution and mental health emergency room visits. And there were 3 studies done in the 70s and early 80s in 3 different locations in the country. But of course, temperature is confounded with air pollution in all 3 of those places. It was Sacramento, I think Dayton, Ohio, and another place, and maybe the St. Louis area was the other location for the other study. And I've always wanted somebody to do an air pollution and mental health study in Denver on the front range where it's cold when it's polluted. So,
Good point.
but there's
That's a good
definitely, and I
thought of
think there are some more recent studies on mental health emergency room visits and air pollution as well. And follow that as closely.
Another question, yeah.
Just a quick, I know you got to close here, but are you part of the meeting with the government? Yeah, or
I
can
was
you-
supposed to be, unfortunately, I ended up having to work.
Can you say more about what the kind of policy shifts that group of physicians might ask for? Or is it just a kind of dialogue around policy change?
The honest answer is I don't know, but it's huge that the governor is willing to meet with a group of physicians who are all interested in air pollution and climate change issues. So it's just that, a meeting and a discussion this hasn't happened before that I know of.
Okay, I think we should stop there. Thank you all for coming.
Thank you.